to the V Lab. This is our second day. It's been a great day. Shelley, Lyford from West Health, Gase Ventures, Gallup kind of pulled together their resources, both capital, but more importantly, the vision they had for creating a different kind of space at Davos this year to talk about themes like everything from victory around sports, velocity around AI, vitality around healthcare. We actually started yesterday with the Vatican and had a mass in here and then had conversations about what it looks like to have virtuous leadership. It's been really, really kick-ass so far. This is going to be a great panel. Strong women talking about the future of healthcare and the workforce. So with that, Shelley, Lyford, please come on up and kick us off.
So terrific. As JR mentioned, that we kind of have a V theme here, and tonight's V word is vitality. And so I'm very excited to speak with you, Linda and Lisa, about vitality and how you are truly changing lives with your businesses, your unique models, and making something that has been, I'm going to say at least in America, like almost vilified, accessible to a lot of people, and you are changing lives. So let me just quickly just say a few things here. Obviously, you are two leaders who understand well population health. And you know population health is not just a clinical issue. Health happens outside the four walls of a healthcare institution, and life leads you to make a lot of choices and in your behavior. You are advancing in both your workplaces whole person approaches that are really unique. You're showing some amazing data, some amazing cost savings, and more than anything, you are absolutely saving lives. So I think most people in this room, when you think about GLP1s, you probably think about Ozempic. I think everyone in America probably knows that jingle if you see it on the commercials all the time. But what is less known is that these therapies are saving lives. In fact, they have the potential to rival the impact of other breakthrough medical innovations, including gene editing technologies like CRISPR. So let's just think about that for a minute. Yet, these drugs have been dismissed as vanity drugs. And meanwhile, we routinely accept therapies that cost $50,000 a year or more for a patient that delivers only marginal benefits. Used responsibly, GLP-1, they are both life-saving and they're absolutely cost-effective. So that is what we're going to talk about tonight. But before we jump into that, Lisa, I heard a rumor that earlier this morning, your CEO, Greg Case, was a 20-year veteran in the industry, a great leader, was talking about menopause and talking about women's health. So let's just, Aon, I kind of feel like maybe y'all are on the bleeding edge here, GLP-1s, menopause. Can you go ahead and tell us a little bit more about that?
So that rumor is true. He was, and he does talk about it quite a bit. And what I would say is I've had the privilege of working with the amazing team at Aon for the last 7 years, and in a role where I get to have an impact on our population health, on helping our clients with their population health, and many, many other things. But when I started, one of the first things I think that we jumped ahead of was, if you go back 5-6 years, no one would say the word mental health. Like, for some of you, you're like, that's hard to believe. And we were an organization that said no more. That's not the case. We are going to bring it to the forefront. We're going to start to talk about solutions. And we're going to start to move the conversation from ill-being to well-being. And there's a big distinction between that. Ill-being to well-being. So there's a theme there. Fast forward, there's all sorts of different things, but on the women's health, from a women's health perspective in general, I will just say that we've been doing quite a bit of work on making sure we're balancing that. We're trying to figure out what's going on with women in the workforce, quite frankly. And so menopause is a big topic for us. It's a big topic with our clients on how we're getting in front of it. And I know we're going to talk about GLP1s in particular. And so we've done a bunch of studies. We'll get into that later, I'm sure. It's not studies, data. We have a bunch of data and analytics. But before I talk about that, one of the things that we did find out a year ago when we looked at a cohort of people that were part of GLP1s was that it's a pretty large population. Again, we'll get into that later. But the average age of someone on a GLP1 is 49. And 64% of the users of GLP-1s are female. Let me just say that again. The average age is 49, and 64% of the users are female. So I'll leave it at that with why Greg Case would talk about menopause this morning, but no surprise.
Great, great. So women's health, cutting edge. We're going to segue right to you, Linda. And let's talk a little bit about your background, eMed, and if you could also enlighten everyone around SheMed.
I'm happy to do that, and I'm actually thrilled and honored to be here to talk about it tonight. While eMed is what I do every day for work, it's become a passion point for all the reasons that you said. In my background in particular, I've spent most of my career in or around media and transformation, particularly driven by technology transformation. And it has been around platforms and brands that touch people's lives every single day. Did it for a really super long time in media. Some of you here know that. Then I spent a bit of time in tech doing it there. And when I had the opportunity to think about what I was going to do next, that's how I very quickly landed on eMed, because leadership skills and all the things that are important to be a visionary like Lisa and Greg, particularly in the GLP-1 space, which we'll talk about, those kind of things are portable, right? But what I wanted to do at this point in my career was then say, what are those portable skills most best used, right? So two things, especially at Davos that we're talking about, AI and GLP-1 medication. So eMed is really the technology platform that brings together both of those things. So what we do at eMed, in addition to partnering with Aon, is make those GLP-1 medications accessible, accountable to our people who are on a program, and affordable, most importantly, to employers. And what's required is to talk about that those GLP-1 medications are not cosmetic. Right. They're clinical. They're saving lives. So that's how I'm here, landed here today.
Excellent. So before we kind of get into the meat of it, I'd love for you, Linda, to outline for everyone in the audience your partnership and the relationship that eMed has with Aon.
Oh my goodness, I don't know where the partnership begins and ends. And we could be up here all night long. But, we have a strategic partnership with Aon. Most importantly, Aon's trust and partnership in eMed is because of our program performance. And we are very fortunate that Aon's employees have access and use the eMed program. And what's most important about that program is that the data that we are delivering, because of the structure and the rigor of our program, are delivering over 90%, I think the number is 93% adherence to use of the medications. And the only way the program works for the employee, right, or the member using it, is if they stay on their medication so they can experience the health benefits, whether it is reduction in menopause symptoms, whether it is cholesterol or less instances of hospitalizations. You have to stay on the program. And then when that happens, then the employer experiences the ROI or the investment, the economics work. It pays for itself. And that's where actually I think the vision, and I was going to say, what a time we live in, that we have a CEO male talking about menopause. We should applaud that, and very, very grateful for that. But that describes, a large part of the foundational elements of our partnership. And then also what I do all the time with Lisa and her team is go talk to other employers all over the world, actually, and try to inspire them about the results of our partnership to get them to, I know it's hard to be first, and I'm thankful to Aon for being first, to embrace these kind of GLP-1 programs, and we kind of spread all that data and success and bringing more and more people on every single day.
That's great. So I think that there's magic happening on the clinical front for the patients, but magic happening on a business front as well. And so, Lisa, talk us through how really Aon was so courageous to be the first mover, and what that has meant from a business perspective for you, and what that has meant from a health benefit perspective for your employees.
So we're a very data-focused organization, but also, again, try to be very forward thinking about what we do from a benefits perspective for our colleagues, and also to be an incubator for other businesses, so things that we'll do. So just a little bit of a story for everyone to set context of how we came into each other's lives and what happened. But in March of 2024, so not that long ago. Let me get this. Yeah, March of 2024. Greg had someone come to us that was a medical professional who had been very astute and had done tons of research on GLP-1s. Happened to be out of Stanford University. And and left me with something. Now, I'm going to be very honest with everyone. In March of 2024, I was a little bit like, I don't really know. Is this like not the vanity thing, but I was like, there's nothing like that. There's got to be terrible side effects. There's got to be something really, really not right here. And so he met with us, and he told us something that stuck with me. And he said, in my lifetime, he happened to be 70 years old, there was one thing that we were certain of that was anti-disease. And he said that was either lifting weights or doing some type of use of your muscles after the age of 40, that actually could be anti-disease, that they had proven it, that it had been proven. And that he thought that in his lifetime that GLP-1s would be the next thing that would be anti-disease. And I literally didn't know enough about it. He spent a couple hours with us, like kind of taking us through it. So fast forward, we're getting ready for open enrollment, which we do in November. And Greg and I were having conversations about the drug's expensive. We're giving access to our colleagues, but it's still costing quite a bit. What if we didn't do that? What if we said we're going to actually provide it to them at a very, very low cost? And we agreed that was a good idea, but we also said, but what are we going to do about adherence? We're not really certain, like if people again, side effects, all these other things. And that's where eMed came in. And so that's where we jumped into the pool with eMed and said, we're going to do this. We're going to offer this low cost to our colleagues, but we're also going to have them do it through the eMed program. If they were already on the drug, they had 6 or 7 months before they had to be part of the eMed program. But that's where it kind of all came together. Fast forward now into 25, and so now in March of 2025. We have a health team and health analytics and data work that we do all the time. So we have 50 million claims that we have access to in our data system. So that's 50 million things, or 50 million people, and what their claims and what they're doing. And so we started to follow a cohort of people that had been on GLP-1s for weight loss. And at the time, we had a cohort of, let's just say, about 50,000 people that were watching. What we did to create a control group is we did digital twins, which I'm sure many of you are familiar with, but just in case you're not, it's, so I'm in the cohort, I'm Lisa Stevens, or Lisa. Lisa lives in LA. She has diabetes type 2, she's obese, she has mental health issues. The digital twins would be same demographics, same issues, same claims, so matching up the claims. So the claims to date are the same. And we use those as a comparison as our control group. What we found back in March last year with that study and into April and May, because every month we get another month of data. So just think, Shelley, like now I'll slice to where we are now. So that's where we found the statistic on the 40, the 49, and the 64% being female. But we also saw incredible improvement in cardiovascular health, incredible improvement in all sorts of different things, osteoporosis, drug addiction, alcoholism. There are many, many things. So we had started the program for our own Aon, and then our own health team of data and analytics said, you're making the right decision because you're going to bend the health curve eventually, because these people are going to end up, an average heart attack, $40,000, $50,000 if you do, if I have any benefits gurus in the room, if you're in the United States, and the list goes on of the issues. And so fast forward, Linda joins in July, and we're both super passionate about a lot of things, but one of the things is there isn't enough information on women's health. And Linda was like, could we slice it? Could we spend some time doing it, slicing it by women? And so we can talk a little bit about that, but we found out some astounding things about women's health in the last 2 months. And we have now 30 months total. We have about 18 months with Zepbound, which is one of the new drugs. It's not Ozempic, it's not Wachovia. It's,
I don't think there's a jingle.
I know, there isn't a jingle.
There isn't a jingle unless you create one, Linda.
Maybe. But it would be inspiring to write a jingle. Just what the data is stunning out of the most recent Aon study, particularly as it pertains to women, right? So 50% or 47% less hospitalizations for cardiovascular disease. You have 50% less instance of ovarian cancer claims, right? And then you have 14% less claims for breast cancer, okay? Those are stunning data points that when you broaden it out, really convince you that an immediate education is necessary, but also a focus from employers to get motivated and get to it already, right? When you lift up the employee population, what is it, about 60%, particularly in the US, get their benefits from their employer. And it is really urgent for the leaders in this room to start educating themselves as a leadership team, and then also inspire their employees that these health options are available to them. Because if you continue on with a female health focus, another benefit is improvement of PCOS, right? Yeah. Women are finding that they're able to get pregnant when they haven't been able to in the past. So when you think that you broaden it out to fertility issues, you think about the responsibility of leadership, right? Demonstrating by actually doing it with Lisa and Greg and the whole company, but the responsibility of leadership is now to take that, torch from Aon and pass that on, particularly urgent in women's healthcare.
So I think there have been anecdotes and a lot of discussions around the idea that this also helps with maybe curbing drinking and perhaps plaque in the brain.
Yeah, well, I think the conversation has evolved or matured to, I think what everyone's talking about is longevity, right? And you talk about these preventative opportunities leading to longevity, that makes sense. But one of the most stunning data points that has emerged was that for the first time, they think it could really make an impact and give people the opportunity to fight the demons of addiction, right? Now, that if all of these things we're talking about haven't gotten everyone's attention, right, you have to pay attention. But from an employer standpoint, on every CEO's desk is almost like you're at a fork in the road. Of course, every CEO wants to make their employee population healthier, happier, right? And liberating them both physically and emotionally to live a healthier life, but it's really, really expensive. The data that we're seeing at eMed, because of the structure of our program, that on average, the employer starts to see over an annual basis almost a $3,000 savings in medical cost per employee.
That's amazing.
So imagine that at scale. And we're just in the early innings of it. But that's the early data coming from eMed. And we're going to continue. We're going to continue pushing.
The one thing, though, we were with a company that spends.
She's going to beat that number. I can tell. That's what's coming.
We again in the U.S. we spend $1.7 trillion on obesity-related issues. It's amazing when you just you think about that. But Linda and I were with a company recently that is spending. They believe in they believe in providing GLP1s, and they provide it. It's covered for their employees. They're spending about $100 million a year on the drug. Their adherence is at 60%, which means that 40% of the time it's not working. It's getting thrown. It's getting that's like throwing money in the fireplace. Like it's
40 million.
40 million.
Yeah.
And what I can tell you is there's not a structured program.
That's exactly what I was just going to say. So the piece of this that's really important is it's one thing to have access to the drug. It's one thing if an employer decides to cover the drug, but if you're going to cover the drug, what you do to support the colleagues and what you do around adherence is critical, and that's where the partnership really came into play with eMed.
Right. So Linda, tell us about kind of that 24/7 support that is assuring adherence.
Well, I think the first thing that's really, really important to let everyone know about eMed is we're one of the only, if not very few, companies that require labs to qualify for our program. So you have to take a blood test to come on to see if you qualify. And you do it in the comfort of your own home. You download our app, you request the kit, it gets sent to your home via FedEx. You get it, you have a live proctor talking you through, leading you through the whole collection. It takes maybe less than 10 minutes. Important to know that 24/7 availability, so on your own time. And what's really important for employers to think about it, you don't have to make a doctor's visit. You don't have to then go to a lab to get the results. But what's really important is while you're on the phone with us, we are communicating with FedEx to come to your house and pick up the kit so you can send it in right away and get the results right away. The reason I tell you this is should you qualify for our program, then we give you the prescription. But what's really important is we make sure the right people get on the program at the get-go. So you kind of filter out the people who are in it for a quick fix, right? That want to lose, 5 pounds to go on a beach vacation, whatever that may be. We are not a quick fix. It's not a hack. This is a focus on your long-term health. And once you qualify to get on the program, you are required to check in with us weekly. You check in with us weekly. It takes less than 60 seconds. You let us know you took your medication, and we see how you're doing. And when you're required to do that for at least 3 times a month, you actually are accountable. We kind of wrap this community blanket around you. You become part of the eMed community, and you start immediately experiencing the benefits, so you stay on it. And that's really what's delivering the 93% adherence rate for Aon, and it's every one of our companies that we're partnered with are well over 90%.
Oh, that's remarkable.
Make sense?
Tell us a little bit about the relationship with Thrive.
Oh, goodness, Thrive. I don't know if anyone of you know anything about Thrive Global, but it's Ariana Huffington's health lifestyle company. And they have, kind of 5 pillars from nutrition to exercise to stress management to sleep to meditation. All of those things bring what I like to tell everyone, especially when Ariana and I are doing things together, is that we brought the soul to the science of eMed. So the medical rigor is absolutely required, but what's also required is to teach people, educate them on how to change their habits, change their lifestyle, and be aware so this does become a lifetime of great health that's in their fingertips now. So we work together a lot. We go see a lot of people together, and it really does work together when you bring together the soul and the science of our 2 companies.
It's fabulous.
We started using Ariana's firm at the same time that we started eMed, but we had just a generic program that was for all of our colleagues to really focus on, again, mental health and again, the whole person. And as we were going through and working with eMed, we got the feedback from our colleagues that they needed more. They wanted a community, they wanted coaching, they wanted help on nutrition, on exercise, those types of things. And so the partnership of having that, there's coaching that they can get on a regular basis when they need it. But there's also this community now that they have of being able to reach out to each other, which is huge. And it's been a fantastic partnership.
Right out of the gate, but I think the commonality of really what brought Thrive and eMed together, if you heard Lisa mention more than once, the availability of coaching, okay? People really need the availability of someone to partner with them and take them along every step of the way because it's new. So there's many companies out there, for example, I talk a lot about how the relationship stops at the prescription pad. Probably everyone in this room could, in an hour or two, get a prescription from a provider or however you get it these days, and it would take you a couple of hours. But the relationship can't stop at the prescription pad because then you're left on your own. And whether you experience any type of side effect or you want to seek out some education to keep you going to retrain your brain, you need a coach. You need a community around you so you can share your experiences and your outcomes. And that's what makes it work.
Fabulous. So one thing that we haven't talked about, and there's kind of a lot of scuttlebutt in the United States, I think I want to talk about a system problem, and that's where we're going to go next. But before that, if we did have more AONs, if we were able to really kind of democratize this drug and get it into the hands and bodies of people who need it across America, do we have the capacity for that? Are the drug makers able to create the supply?
That's a question for you.
Well, I think it's a great question, and more supply is coming on the market and availability. If you know, was it 2 weeks ago now that Novo Nordisk came out with the pills that were available? So particularly, you'll meet the demand, but particularly for certain people, mostly men, by the way. This is a new stat that I learned, that mostly men shy away from the GLP-1 medications or medications overall because they don't like taking an injection. So the pills, we believe, is going to take probably a 70-30 split women to men and make it kind of even out because men will be inspired to do because that barrier isn't there. That's number one. Number two, there are other companies that will be coming to the marketplace, if you will, whether it is Amgen or Pfizer coming to the market. So I think the supply capacity is there and it's going to get better. But it will be interesting as it plays out because the demand is going to continue to increase. The great thing, we're very fortunate at eMed to have very close relationships with both Lilly and Novo Nordisk to partner with them very closely. For example, we're already able to offer the Novo Nordisk pills in addition to the other formats that are available to people because our goal is to give as best that's available to our members so we can serve them, to use your word, on their whole life basis.
Yeah, that's great. So Lisa, as we wrap this up, we just, I can't help but think of how bleeding edge and how courageous Aon is. And you're just an amazing leader in this space. You are tackling the system problem. So what advice would you give other companies to tackle that and to not be afraid?
So I would say that every company is going through their own journey of what they can and can't cover with benefits, and so learning as much as possible about alternatives and things that you could or couldn't do, I think was one thing I would say, and then recognizing it's so hard, companies are typically, if you're publicly traded, you're quarterly focused. And so if you can take that long-term look, which we were willing to take the bet on, and see the bend in the health curve costs, and not. Again, we're talking about a much larger population than Aon, which is 60,000 people, but even still, but the impact. People, obese. When people that are obese have 128% more absenteeism than 100. It's so high above anything else. And when you think about the stigma that Linda was talking about, I think that fundamentally wanting to treat people with dignity and respect and help them to be their best selves, you get a more engaged colleague, you get a more engaged employee, but also it's that focus again on, can you shift some of the things that you're doing with your benefits away from just the reactive ill-being to well-being.
Excellent.
And so that would be my take. And I'd say that's been, since the day I came to Aon, that's been at the core of our culture of like, we have to care about the whole person. If you're more engaged, you're more productive. If you're more engaged, you tend to want to, get out there and you're happier. And I'm lucky enough to, I get all the anecdotal. So I'll be sitting next to, a colleague at dinner. I was sitting next to a colleague at dinner last week in New York. And he was telling me the story about how he's lost 60 pounds. And he was talking about how much eMed had helped him, with the weekly thing. But he's like, my family is so much happier. My kids are so much happier. And I get to hear that all the time, like that reinforcement, which is so powerful. And this is someone that said that since he's been 12 years old, he's been struggling with weight.
Wow.
And he's now 57, and he's like, I actually like looking in the mirror for the first time for as long as I can remember. And I get to hear that kind of stuff all the time, which is really cool.
So Linda, finally, I would like you to close the session around the integration of GLP1s into whole person care, eMed's kind of bigger strategy, and you just brought on Tom Brady as the Chief Wellness Officer, and how this all kind of integrates.
I knew she was going to go there.
I am more than happy to close with Tom Brady.
Tom Brady.
That is really, thank you for the elegant way to talk about Tom Brady. And I was going to say, it's really not a coincidence, but everything that Lisa was just talking about, where those quotes or those experiences may sound anecdotal. One thing she said about employees being more productive and making they're with their families more, they're able to come to work more, they're happier in the office. And one thing in the last meeting I was with our Chief Wellness Officer, Tom Brady, I think he's kind of famous for saying, the best ability is availability. And we have been talking about that as we've been designing kind of new phases of our program alongside him. But, you have to take that kind of thought seriously, because whether you're available to come to work or whether you're available to be present with your families, the true vision for eMed is to not only liberate people physically because they feel better, they like looking in the mirror for the first time together, and they can spend more time chasing their children around the playground, but emotionally they're liberated too, because they don't have to experience what many people don't ever, obesity discrimination. They're going to be considered for jobs they could never be considered before. They could buy a ticket for airplane travel that would be such a source of stress for them, and the list goes on and on and on. But in addition to working with Tom Brady, we do have the core same mission, and that is to help break the curve of the terrible nature that's confronted CEOs from the cost, but to make people healthier. So that's what it's all about.
So you just mentioned a 5th A that you need to add to your deck. Available.
So you have accessible. We
Adherence.
said adherence, right? Accountability, and affordability.
And now availability.
Okay, so that's what I said. Okay.
5 is availability.
See,
Thank you, Tom Brady.
I have to update all my materials immediately.
All right, I'd like to thank this amazing panel.
Oh my God,
Thank you.
what a treat. You know what? I'm so happy to know you. I'm so happy to know you.